I think some fun ones would be like filler in the balls of your feet.
Is that a thing?
That is a thing.
And
Oh,
also
wow.
Tox there is the thing.
How
too,
long
for
does it
high
last?
heels. The filler will probably last a year.
Client.
See ya.
Hi guys, welcome to the Nitra channel. My name's Eliza Sudol and we are here at the Aesthetic Show. And I'm here with the lovely Lani Doser and Kelly. How are you guys?
Good. Thank you for having us.
Thanks for coming here. Yeah. How's the conference been thus far?
It's been good. Yeah, I think there's a lot of walking that I forget about every year, but
the feet are hurting.
Yes.
How cold it is down here.
Yeah.
Where are you guys located? How large is the practice? You know, maybe just some like geographic background. Would love to hear that.
So we are in Portland, Oregon. We're just outside of Portland by maybe 15 minutes. We are a very small clinic. We only have one location, and there are only 4 of us in the actual practice.
And we specialize in, as I said before, skin, scars, and actually skin of color, and we sell only K-beauty in our clinic.
How did you get into this career path of yours?
I was interested in aesthetics actually at a really young age. I grew up in a very small farming community outside of Portland, so it was in northeastern Oregon, and was extremely aware that my skin tone did not get me access to places that I wanted to get. And then in college, I actually had cystic acne with scarring. So I wanted to treat those scars, and I saw a very large name plastic surgeon who then treated those scars with laser, but it was just too early to be treating skin of color with laser, and I got hypopigmentation. So paradoxically, the thing I was trying to treat to get better actually got worse. And so at that time, I thought there has to be a better way to do this. And I really saw working with skin as a way to provide a leveling field, or at least a step up onto the playing field of life, and how acne and acne scarring and other types of scars, dog bites, how they really socioeconomically impact that individual, from not getting the interviews that you want, from decreasing the amount of total pay that you will be able to produce in a lifetime, to people thinking that you're less intelligent. So these are all things that resounded within me because I had experienced it. And so I really wanted to found a clinic like that. So I've been in aesthetics for a very long time and started Skinwise about in 2017. It's been very rewarding. We do things differently than other clinics.
Definitely agree. I think we're more prescriptive as a clinic, whereas I think a lot of other clinics allow you to come in and dictate your own path regardless of if that treatment is the right one for you. So instead, we always start with a consultation. We ask you what your concern is, and then from there, we give you the treatment plan. And obviously, we try and include you in the decision making as well, but ultimately, you know, we are the professionals, so hopefully, you know, you can trust us with the decision making that goes along with the best plan of care.
And I think part of that is helping people. People come to you with vulnerabilities. That's why they're coming to you in aesthetics. Mm-hmm. And almost everybody who steps in the door is experiencing some kind of loss. It may be loss of a job, loss of a boyfriend or partner. It may be loss of confidence or self-esteem. So it's really about creating what they're hoping to have in a plan that's evidence-based. So the problem with aesthetics is that because it is retail medicine, there is more hype than there is actually evidence. And you want to find somebody who has background not only in skin of color, darker skin tones, but also that studies the evidence, gets education and training, and really tries to focus on reproducible results for you.
Well, I must say you guys both have beautiful skin. If I'm ever in Portland, I'll stop by.
Please do.
Because I want your skin. I really thank you guys for sharing that information, especially just about your experience, how you started your practice, you know, what motivated you. Within the industry, what would you say, like, have you noticed that's changed since you started in both positive and negative, and where do you see the industry going as a whole?
One of the things that has occurred is that there's more education, but it's hard to know whether it's education versus being influenced. I think social media wasn't a thing when I started, and it is the thing now. So sometimes you get some good information about it, and sometimes you get misinformation, unfortunately. And so you can have people coming with highly filtered photographs or selfies that are not truly authentic and wanting to recreate the same thing. I think also when I first started, people would come in and say things like, I'm tired, or I really want this job. And they were less obsessed about, I want Botox or Xeomin or Dysport by name. So I think you are getting a more educated population, but it's only surface education. They're asking for a certain thing that may or may not be appropriate for them. Would you agree with that?
Yeah, definitely.
When people are going to find a doctor of, whatever it is, whether it's for your skin or it's injectables, they want Botox, they want filler, whatever it is, what research should they be doing to find a good injector or a good doctor that is going to have the proper education to, know what they need and not either over-inject or, with all that misinformation? I think that can be worrisome for people, and with social media being so popular, you might see this person has thousands of followers, but you don't really know if they're qualified, right? So what advice would you give to patients?
I think you can do some basic education even if you go onto YouTube and watch things. There's a very interesting expose done by John Oliver that's actually 30 minutes long about aesthetics as a business and how untrustworthy it can be. He went through a couple of points about the things that you should look for in your clinician. One of them is that, are they licensed, and are they licensed to do what it is that you're going to have done? Do they have patients that actually get treated by them? So there are medical directors that will sign off on things, but they may be 100 miles away. So that's one of the things, is check the licensure. Another thing is to, when you actually get your injections, it is completely okay and appropriate to ask to see the box and to verify that the box is a true
authentic
product that you're getting and that it's in English. Because one thing that has been happening are people are buying counterfeit medications and using them. And unfortunately, last year there were 15 people that were hospitalized. 9 of them tested positive for botulism. There was a person at a non-clinical setting that is tested positive for botulism. And botulism is a hard thing to come back from. There was a place in Arizona where there were people that actually got HIV from poor microneedling technique. So I think the other thing is, use your eyes. Does it look clean? Does it look like a clinical staff? Check the licensure. You can do other things like, do they appear the way you're hoping to present yourself? If they look plastic fantastic, and I'm not here to judge in any way, and that's not your aesthetic, that is not the person that you want to be treated by. So I think those are kind of starting places. You can always go online and check, and one nice thing about that is that you can find out more about your person. No matter who you dig into, you're going to find some negative reviews, but hopefully you're also going to find some positive reviews.
I think one other thing, Lani spoke to a lot of great points. Usually your friends will have a lot of referrals, and if you hear a name multiple times as well, or even from other professionals in the industry who are referring, that's usually a good sign as well.
That's true. I would say that probably 70 to 80% of our people come from a referral source.
Other professional sources.
In professional sources, yeah. And I also want to clarify, my name is Lani Doser, and I have a doctor of nurse practice. I am a nurse practitioner and a family nurse practitioner.
She does it all.
She does.
As we were kind of just talking about, and I think this is interesting, and you always hear these crazy wild stories on social media of these botched procedures or what went wrong. What is the craziest thing that you've heard of within the industry where you're like, oh my gosh?
Well,
is it worrisome too?
So I think, yes, the most tragic things, there was a person that died in Texas, and they were getting simple IV infusions, which, there's a question, do you need to be getting IV vitamins? but
I think it was also by somebody who was not
unlicensed person, and the physician was about 100 miles away. So that's probably the worst. I think the other things that you hear about are people that get Brazilian injection butt lifts, and there was a person that actually was injected with cement. It was actual cement.
I did hear about that.
And I think Dr. Shinobe was a part of removal. So I would say that the things that we hear of are not crazy funny, they're crazy really sad. And I think,
and it's scary.
Well, and I think even for us, this report of botulism came in this month. There are TikToks teaching people how to inject themselves with tox at home and order the tox through Alibaba. And what you're getting, you may be lucky, it may be real botulinum toxin A, but if it's real botulism, that is, you have to be hospitalized, you have to receive a special set of medications.
I mean, to clarify, like, you go through schooling, a long process of education in order to inject. And I don't think anyone should be purchasing Botox or any other injection off of a random website and then injecting themselves or having a friend inject them. I don't know, to save a little bit of money. I mean, that's pretty crazy. So definitely safety first.
Yeah.
I do want to just like rapid fire off some questions here. What would you say, and these are just going to be completely kind of everywhere, what is the most popular procedure that you've been seeing lately?
So in our clinic, or just do you mean nationally?
Both. Let's do both.
So nationally, I feel like PDRNs and exosomes are huge. I think that there's still evidence out there, whether it's going to be here forever or if it's just going to be a fad. So we know that PDRNs, for example, helps with wound healing, and there's evidence-based for 20 years. But does it help with the skin? And actually what we're seeing more are PDRNs within skincare products, and it's really controversial whether it can actually penetrate through the surface of the skin. Exosomes is also another area that is extremely complicated. It is regulated highly in the United States, and so the question is if you use a plant-based exosome, does that actually send that signaling that you want? If you use human-derived, that's illegal in the United States. But at our clinic, what do you think is?
I mean, obviously injectables, I think we do a lot of Dysport, we do a lot of Restylane filler. I think Sculptra is huge for us. Lasers, Pico laser is one of our favorite right now.
It's definitely dependent upon the provider too. So
yeah, if you ask all of us, it's a different answer.
Haley's going to be Pico. I love Sculptra. We have a CO2 device that we're really in love with right now. So we love all of those things. Laser in general, you don't really do during the summer. We have an Agnes device that we love for reduction of jowls and also acne. I'd have to say that we actually love
We love everything that we do.
We'll take one of everything.
Yeah.
We love it all.
Yes, exactly.
What are 5 devices that you think every practice should have? A similar practice to yours, of course, whether that be lasers or...
Yeah, I think a Pico laser that does 532, 1064. If you're lucky, you may get a 755, but they're problematic. They break down a lot. I think definitely radiofrequency microneedling. That's 2.
I think even traditional microneedling is great.
A vessel laser, whether it's a 585 or 595, is typical. A long pulse 1064. We have a non-ablative resurfacing, which is a 1927 thulium laser that we love.
Is there any injectable or procedure that you think is really overrated that a lot of people are doing?
I think one thing that's really different is that when I originally started, people wanted to come in and they wanted enormous, the Jenner lips essentially, and that is no longer a thing. People come in and they're like, I want just a tit, just like a sprinkling, and sometimes that works and sometimes we have to be realistic about what the lips can take, but also sometimes we're actually reversing filler because it's 10 years of filler that's floating around in the face. So I do think that too much filler is overrated and out.
And with the clean girl aesthetic.
Yeah, and I also think be really aware of things like the products. People are This is my opinion, so it's not popular, but...
No, we want your opinion. That's why we're interviewing you.
Well, they call it medical grade skincare. I don't believe in it. I don't think it's a thing. There's not... They say that they're at a higher echelon, but there is nothing that says something's medical grade unless they say that it's medical grade. They don't jump through a hoop. They don't get licensing or certification about it. Medical grade is a way that a company can charge more for their product, and it may be an excellent product, but whether or not the ingredients, right, I think it can be overrated. I think there's a lot of hype.
So what's the difference then, I guess, in what people say is medical grade versus what you buy at a drugstore or at Sephora?
Okay, I'll give you one example. There's a company called Bayersdorf, and they own a excellent tyrosinase blocker for pigmentation. So it's excellent for people with melasma or people that want treated with devices during the summer. And they own 3 companies. They own Nivea, Eucerin, and La Prairie. And they all make the same serum. It's $40 through Eucerin, $40 through Nivea, and $400 through La Prairie. So you tell me now, what do you want to pay? Now you may feel better as a consumer to buy the medical grade, which is La Prairie. But I would tell you that most people would be more comfortable buying the Nivea or the Eucerin.
That's really great insight. What is the wildest client request you've ever gotten?
I don't know if we can tell that, and I don't know if it's legal.
We're not going to name.
Well, you don't name the
obviously.
person.
The VAJACIal?
We don't
definite.
do it. Yeah, we don't do any of that.
Or the,
Okay.
We don't do it.
We don't do that.
The steaming?
No.
Yeah, okay.
No.
Yeah.
Okay. I've seen those products on Amazon.
I mean, I have funny clients when I do like laser hair removal where you're like, I'm doing a Brazilian and I walk in the room and they're fully naked just sitting on the bed and I'm like, okay, we're doing this. And that's, you know what? If that's what makes you feel comfortable, I'm not going to be here to judge, and I will make you as comfortable as possible.
My best friend made that mistake. She was getting Brazilian for the first time, and she was like, okay, you know, like take your clothes off, which I guess it just didn't process in her mind. So she got fully naked and laid down, and the lady was like,
you just go with it, and I think a lot of people feel uncomfortable in those scenarios, thinking like, "Oh, they're judging me." Half the time, we're like, "What am I having for lunch?"
The other thing is that they get a towel, and that's the other thing is that the towel end up around the neck or
you're like, I don't know what you were doing.
Around over one arm.
Be like,
I think some fun ones would be like filler in the balls of your feet, so that we could walk up and down here
for comfort in heels.
is that a thing?
That is
It
a
is
thing.
a thing. And
Oh,
also
wow.
Tox there is the thing.
How
too,
long
for
does it
high
last?
heels. The filler will probably last a year. Come and see us.
What is one trend in this industry that you wish would disappear?
One trend that I wish was more of was just more evidence, but it's just you have too many splintered groups all trying to get to market as fast as possible, and it's just not going to happen. So there was one treatment that we had that we loved that we bought here last year, Brella, that's already bankrupt. So now we have 20 packages of Brella and we can't even sell it. So that was for underarm sweating. Excellent treatment.
I did do it before we came.
Yes.
What is one piece of advice that you would give other physicians, and what is the best piece of advice that you have received from another physician?
So as a nurse practitioner, I feel like one piece of advice that I got very early on that I abided by was to do your thing, grow slow, and do injectables only. Don't invest into equipment until you feel like you can either be at the ROI that you want to be at or that you can pay cash out of pocket, because a lot of these devices are easy $100,000, $200,000 out of pocket, and so you can go into debt from just the very beginning. I think the best piece of advice I have is to remain humble, to know that complication exists, and to create a community, because I think that a problem in this area is that there's complete siloing and there's a lot of competition. So as much as you can reach out, network, meet other people, come to conferences. It's really important that you have somebody to fall back on so that hopefully you don't have complications, but they occur, and we help clinics out all the time with them, and you want to have that backup person helping you out. So I would say number one is watch your spending. Don't get any devices to start out with. And then number two, build a community, somebody who will catch you when you fall, and it will happen.
Thank you guys so much for joining us today. I seriously appreciate it. Loved all of your insights and learning more about your practice and your role. I think this is so amazing. We definitely need more of this in the industry, so we really appreciate it.
Thank you for having us.
We got taken to a very nice dinner last night at Pisces, and we had some wonderful seafood.
What was your favorite thing?
Well, there was one thing that we wish that we had ordered that we didn't, but the potatoes were excellent.
The potatoes were
truffle
delicious,
potatoes.
so
yeah.
Thank you very much. It was
Thank you.
very good.
Yes, thank you, Nitra.
Of course. So we're on the first day of the aesthetic show. Have you guys been to the aesthetic show before? Is this your first time?
I've been able to present for probably the last 4 or 5 years. And it was through the aesthetic show that I actually met Alex. And I kind of told a funny story about how I met him last year. And that's how we ended up choosing to go with Nitra. Yeah.
Well, I think what would be really important is for everyone to have a little bit of a background on both of you. So if you can just share a little bit about yourself, your practice.
So we have a small clinic that specializes in skin and scars in Portland, Oregon. The name is SkinWise. We love what we do. Last year I was in TAS in the exhibition hall, and actually I saw Alex and he did not have anybody around him. I felt bad for him and introduced myself, and then he said, I do credit cards, and I'm like, oh no. But then he actually told me about it, and I thought, well, it sounds really interesting. So I took the information back to Kelly. Kelly is our practice manager at SkinWise.
I think we should backtrack really quick. So Lani is the owner of SkinWise, so I think we need to start there, and I am her practice manager. Yeah, she brought the info back to me. I set up a meeting with Alex. I also was like, this is too good to be true. So then I was like, we need to pass this to our financial person, who then also had a meeting.
He said, this is a scam. And then actually also met with Alex, decided that it really is a very good option, I think, for small businesses that are looking for ways to maximize your savings. Because the way that the card works is that it's a 2.2% return back. So, for example, you'll still see people that have Alaska Airline cards, or even we had the Chase Inc. card. We only get, I think, 2%. It may even go up to 3% back at $25,000, and it's anything above $25,000 for that month, whereas we get an automatic 2.2% back on everything. And then you get 5% back if you spend in the marketplace. And they have essentially a way to sort of be a group purchaser with other clinics. And so it includes things like McKesson, Mertz, Galderma. It's a really powerful way that small businesses that have very few financial backing that can get a leg up.
Thank you for that. That was like, we need to put you on our floor.